More analysis to come. Now strikes. Nurses have done a deal with the government. Teachers are in intensive talks over perhaps a similar deal, but talks with junior doctors collapsed and they will now start a new 4-day strike in a couple of weeks' time. But the British Medical Association says that junior doctors need a 35% pay rise to make up for below inflation rises for many years. And the BMA Junior Doctors Committee co-chair, Dr Rob Lawrenson, joins us now. Thanks very much for being
Good morning, Sophie.
Look, everyone knows the important role that junior doctors play in the health service. Is this strike action, 4 days, is that going to put lives at risk?
I don't think so. And actually, the NHS has shown itself to be very resilient over our last action, which was last week, over a 72-hour period, where many healthcare professionals, like consultants and associate specialists, were able to provide and support care in services like A&E and intensive care.
There's a lot of appointments cancelled, though, isn't there? I mean, there's already a huge backlog. Anyone who's waiting for an appointment knows that.
There is, and that's precisely one of the big arguments that we're trying to put forwards. There's a massive workforce crisis in doctors and other healthcare professionals in the NHS. And I just want to draw a comparison to a normal working day. If a consultant were to go off sick or if they were unable to attend their clinic duties, we'd see all of those appointments rescheduled, and they would be rescheduled for months in advance, which demonstrates how little workforce capacity we have. So this strike action, yes, it causes disruption, and I'm sorry for that, but it just demonstrates that we have 9,000 vacancies in secondary care. We have 6,000 fewer GPs, and it's very difficult for patients to access healthcare that they deserve.
Let's talk numbers. You want a 35% pay rise. It's a pretty big pay rise.
So doctors have lost 26.1% over the last 15 years in real terms, and what we're asking for is for that to be restored. So we're asking for it to go back to a cost-neutral point of view from 2008. And what that looks like is about a £5 to £10 an hour increase. At the moment, doctors start on £14 an hour, and we're just asking for that to be restored to £19 an hour.
I think, look, lots of people would be like, look, junior doctors are underpaid and you've had, as you say, a whole 15 years of squeeze. But is it realistic to be asked to click the fingers at these times of economic difficulties and make up for 15 years' worth of below-inflation pay rises? It's not going to happen, is it?
So there are some challenges that we need to work out in the negotiation room. And
so you're prepared
really
to
what
compromise
we need
and come down, is that what you're saying?
So I think there's many different ways to be able to get to full pay restoration, and I think it's really important. But when we talk about realism or the reasonability of it, I think what's happened is that Mr. Barclay and ourselves are just at different points in trying to tackle this issue. He's coming at it from quibbling over about £1 billion, which, when you put into perspective of the test and trace budget,
but come on, it's very easy to look at the
PPE that was burned, or if you look at the COVID bounce back.
Because I understand, look, it's easy to look at the amount of money that was spent during COVID, but at the time, we were in the middle of a global pandemic. People didn't know what was going on. It was right at the time, some would argue, to put money into things that could try and make a difference. Right now, everyone is belt-tightening across the board. We've seen nurses making a deal. We've seen teachers getting around the table as well. And for many people, you guys look like an outlier.
So, you know, absolutely, and this is what I'm saying. So Mr. Barclay's coming at it from complaining about £1 billion. We're coming at it and saying, look, we have a healthcare crisis at the moment. We have 500 excess deaths, 500 British people dying needlessly a week in winter. And we're trying to address real healthcare crises. And so we're trying to approach this from a perspective of doctors looking after patients and wanting to deliver high-quality healthcare. And Mr. Barclay's just trying to pinch pennies.
Is it penny pinching a 35% pay rise?
I think if you were to ask the ordinary person on the street, would they be happy to pay a doctor 7 p.m. on a Friday night, £19 an hour? I think you'd get a resounding yes, that's reasonable.
Wes Streeting, the man who, of course, could be Health Secretary in 18 months' time, Labour's shadow, said this on Friday on LBC. I don't support the strike, actually. I don't want the strike to go ahead. What's your message to Labour?
Well, I would be happy to work with anyone who is in power to be able to deliver full pay restoration for doctors. Again, you know, this is about trying to address serious workforce crises that are putting each and every one of us at risk every winter. Mr. Streeting's made some comments about not supporting strike, but he did make a comment about understanding the argument for full pay restoration. And I think that's the difference that we have. between Mr Streeting and Mr Barclay. Mr Barclay doesn't even recognise the stresses and the pressures that junior doctors are under, and that's why we're so far apart.
Why are you not getting around the table?
Oh, no, we're very happy to get around the table. So next week will mark 6 months since we started our formal trade dispute, and Mr Barclay's only come to the table twice. It's really very difficult to be able to talk to someone who doesn't even want to invite us in, and indeed, on Wednesday, he left the room.
What happened?
He asked us, what we would like to talk about. We presented our opening position on what we think would constitute full pay restoration and how we'd like to work with him. But he didn't ask us any further questions. He didn't ask us on how to...
so high. Do you think you've gone in too high?
So I think £1 billion for 75,000 junior doctors to be able to try and treat the massive workforce crisis and to be able to deliver high-quality care to the people of this country, I think that's value for money.
OK, thank you very much for coming on the programme. It's good to have you here explaining your position.
Thank you.
Much appreciated. Well, lots of different things on the programme today, and I'm really looking forward to, maybe looking forward to is the wrong word, but I'm very pleased to introduce our next subject, because this week the Justice